Work. No. No. Okay, that's not working. Okay. This works. Like that. There we go. I think. Well, uh, my name's Kashif Abdullah, and I'm a physician here in San Jose, California, and I have a clinic. And I was thinking of just talking to anyone, maybe every 12:30 every day, about half an hour or so, about any medical issues, or specifically now Corona or COVID-19. And I don't know. I thought if anyone's out there that wants to ask questions, they can ask questions. Uh, if anyone's out there, looks like no one's out there. But um, if you have any questions, I don't know. If you have any questions about Corona, we can talk about it. Um, but I wanted to make this a live show, and I'm just waiting for, I guess, listeners. I'm not sure if anyone's out there. I'm sure that's going to take some time. Um, how do we discuss this now? Well, you know, with this whole coronavirus issue, at first I was sort of maybe just thinking, taking this a little bit more lightly than others. But as the days have gone by, I've been getting more concerned. I'm now using masks to see patients every single day. At first, I was just, just general hand washing and making, if someone has a fever, then, using masks, what have you. But now, every time I see a patient, I'm using a mask. So I have this N95 mask here, and I have let's see, and then I covered with this mask just in case, and I have let's see, I've got a thermometer that I take temperature with, or recently got this one, which is basically an electronic thermometer or infrared thermometer. I haven't tried it out yet. I have a friend who's a nurse at a hospital nearby, and he says that they've been using that to check temperature. Um, but one of the biggest things of checking, uh, one of the biggest ways of screening this, it seems to be more than anything else, if you look to the CDC website, is temperature. That's how the first we get your temperature, and your temperature is over about 100, 100.4, or 38 degrees Celsius, then that's the first check mark, or first checkpoint to check. Then after that, we look at cough and fever, and with cough and fever, usually what we're told, what I've been told, is to send people to the county health department, the Santa Clara the Santa Clara Public Health Department, to send for COVID-19. I'm actually next door to a hospital, regional medical center, and they're dealing with their issues. They're just their ER. You can see just from the outside that how packed they are, and it's getting more and more scarier as the days have gone by, and um, I'm also using like this like yellow gown, so I'm literally wearing the N95 mask. Oops, N95 mask. Then I've got this just to because I only have one really. I've got a whole bunch of these things, but I can only do so much with this one mask, and I've been going to anywhere and everywhere to get masks, and I can't get these N95 masks because everyone either bought them or I hoard them or God knows what they've done with these things, and I'm basically just dealing with what I can. I'm also concerned about my family bringing this stuff in. I'm wearing now scrubs. I usually wear shirts and pants and everything, but now I just wear these scrubs, and so when I go home, I'll just take them off. I'll when I see patients, um, I'll wear gloves and everything. Um, but more than anything else, it's hand washing, and hand washing is very important. I would say hand washing with soap for 20 seconds. Now, if you just hand wash with just simple, like if you just hand wash with just water, that's not good enough. You've got to actually use um, like what's it called again? You have to use soap, any soap. It doesn't matter. It doesn't have to be antibacterial. It'll be any soap you can use. That's one of the big things. You've got to use soap. Now I have this hand sanitizer. Where is it? Here is it. This stuff, right? Um, and hand sanitizer is good, but if your hands are soiled, you've got anything else like they're not clean, like just say I don't know, you have something else on it, even dirt or whatever, and this is not going to be good enough. Frankly, you got to wash your hands. It's a physical act of removing the contaminants from your hands, so you got to constantly wash. I've been just constantly, literally 20 seconds, and I've literally 1001, 1002, 1003. I'm literally counting 20 seconds after every patient, or even just normally. Right now, I'm not wearing a mask or anything. No one's in the office right now. I'm just sort of taking this time just to make this video, and it's like it's concerning. And the concerning thing about this is, I've actually spoken to another nurse at another hospital, and she was mentioning how you have to catch this. That it's if this is caught early, like if the symptoms are in the early stages, then treatment is fairly effective, and it gets. Uh, Usually, people are able to recover pretty fast. But the problem is if people come late, like after they've come into what's called ARDS, acute respiratory distress syndrome, that's when it gets dangerous, and that's when people go on ventilators, and that's when it becomes actually really dangerous and maybe even lethal. So you may be asking, so what the heck's ARDS, or acute respiratory distress syndrome? So um, maybe next video I'll use the whiteboard and everything. That's just I deal with a lot of other patients with other issues, but just to recap quickly. Plus, it doesn't look like anyone's watching out there. Maybe someone eventually will start watching, but um, ARDS is acute respiratory distress syndrome, and that's when uh, an infection such as COVID-19 coronavirus comes in and basically activates the immune response or immune modulators. So this kind of response is it basically creates a condition in the lungs where the lungs get full of fluid. So fluid from say um, uh, from literally the capillaries of the arteries, they become leaky, and they start leaking that fluid into the lung tissue, and the lung tissue needs like a bare like it's the gas exchange happens at the lung tissue. I don't know. This is pretty old. I gotta really clean this up. But essentially, what happens is the lungs have this they have this barrier. So so here's the alveoli is a sac essentially. Okay, so um, it's essentially a sac of that allows gas transfer to happen, and um, air comes in and out, right? And around the alveoli are actually capillary is where the capillary where gas exchange happens. Capillaries are so it goes heart, aorta, arterioles, and then capillaries, and then venules, then veins, and then back to the heart. So the capillaries is where all the things happen, where all the gas exchange, all the nutrients are changed. So the lungs, the capillaries basically line the artery, oh sorry, the alveoli, and what happens with ARDS or with coronavirus is the capillaries become leaky, and the fluid between the capillaries, the fluid actually leaks out of the capillaries, out of the blood, and in between the alveoli and the capillaries, or the you want to call them arteries, whatever, and it gets like it becomes a barrier. I don't know if I can show this properly on this notepad, but it becomes a barrier, and becomes this barrier where oxygen no longer can go in between the alveoli or the lungs, the inside of the lungs, to the capillaries, the blood. And so when that doesn't happen, your blood is no longer being oxygenated. and fluid starts to, and then what happens is something called decruitment. There's something called decruitment. Basically, the capillaries also, because of this extra fluid, start collapsing, and so there's less and less lung that's functional and becomes all full of fluid. And with ARDS and coronavirus, this kind of process happens really, really quickly, like literally within hours. So what happens is someone's at the health department, or someone calls in the health department, and that's the biggest thing here in the United States. Is they call in the health department, and the health department says, okay, well, everything's, okay, you have a fever, stay at home, isolate yourself, such and such, or you have a cough, okay, well, they're just so inundated. They're not testing, and they're most hopefully get better, but there are those that don't get better, and they start to get worse and worse and worse. And what happens is what's happening is the infection is growing and the infection causing acute respiratory distress syndrome is happening. So more and more the lung is becoming less and less effective, and then eventually what happens is the lungs are no longer effective to oxygenate the blood, and you're basically having pneumonia essentially at one point. You get other bacterial infections that happen in conjunction with coronavirus, and then it becomes a mess. And that's where a ventilator is needed. So when that happens, then it's just, and the problem is that it happens so quick. So um, ideally, you should go to your primary care provider or your doctor or public health official, and um, they should give you like uh, well, we should test you. Ideally, we should test you. Um, and that's the biggest problem, that we can't test you because we don't have tests. And so what we really have left is just, we've got preventive measures. You have to not get the disease. It sounds crappy. So there's no vaccine. We don't have one. And all we really have is almost what's called supportive measures. Basically, we're just dealing with the problem as is. So if it's ARDS and it's really, really bad, we have to give patients IV steroids to reduce the inflammation. We have to give them antibiotics. And if it's really bad, meaning their oxygenation saturation, I have like a pulse ox here, this thing. If this thing is telling us that your oxygenation saturation is going below 90%, so I'm waiting for this to turn on and give you a reading. I'm not sure if it comes out. It's still figuring it out. But if this says if this oxygenation saturation goes below 90% and goes into like what am I here? It says 98% oxygenation saturation. Well, I'm not sure if it's flipped on your screen. But if this starts going to like 92, 90, 90, 89, now this is bad. That means less and less the lung is functional, and we got to put the patient on a ventilator. And then now, if the entire lung gets full of fluid, your lungs are no longer working, and that's how people pass away. So the issue is, well, we're in a pickle. We got we don't. That's why we're trying to slow the COVID-19 down. If we go too quickly, meaning if we allow too many cases to happen, and if we don't do these preventive measures, and we don't do all this social distancing and all that stuff, and we don't let get people get less and less sick, then what happens is um, we overwhelm the system. There's not enough ventilators for everybody, and this concern is we have what we had in 1918 of the Spanish flu, which by the way wasn't started in Spain. It was just called the Spanish flu because Spain was the most vocal or the most open about this issue. Others were more closed off. So in that case, 65 million people died, which is horrible. And if you look at the world chart, like among the numbers of deaths that have happened in the world, World War One had a huge number of deaths. Then it's the Spanish flu, which by the way was spread because of World War One's troop movement. And then after that, World War Two was the biggest number of deaths in the world. So this is not something that we should, just, oh, it's okay. And I have family members that say, oh, is this true? And they're taking it lightly. And I'm trying to tell them that you can't take this lightly. This is not something to just, oh, well, blow off. Take proper precautions. Don't get too scared. But at the same time, um, this is something you've got to be mindful of. and uh, I'm getting. I'm also concerned for myself. Like I said, I'm trying to take more and more precautions as the days go by. I should take as many. But the thing is, even the CDC is trying to figure out what's the best thing, and even they don't have a clear picture of exactly what to do. We're sort of doing this flying by the seat of our pants. We don't really know what we do know what we're doing, but we don't know what we're doing. I don't know how to exactly best explain this, but um, because we don't know the future, and you know, it's not like I guess my thing is I'm hopeful that this gets better. Um, how fast? I don't know. That's another question people ask me. When is this going to get better? Mm, yeah. I guess one way of figuring out when this is going to get better is when we start seeing cases going down. Like they say that in China the cases are going down. I don't know exactly how accurate that is. Are they accurately reporting all the cases? I don't know because that's where it first started and all what have you. Um, but in Italy, cases have been rising higher and higher, and people are passing. And now the states are just behind. Um, and we need better treat. We need actually just testing. We need better testing to know who's got what, and we need to know because if we have testing, then we can know because coronavirus is similar to other respiratory tract infections. Someone could just have a regular cold and not the coronavirus, and they could have a slight fever, but and that's a problem. This mimics regular fever, regular colds, and the issue is this leads quickly to acute respiratory distress syndrome, ARDS, as opposed to a cold that just you just get over. Runny nose, cough here and there, and then usually there's no fever in a runny nose or re- regular cold. But sometimes some people have fevers, and it's trying to figure things out as we go along. Um, yeah. So uh, looks I'll be doing this like from 12:30 to 1 every day or so. Not every day, but maybe every weekday while I'm in the office. Um, and if people have questions, maybe as the viewership, this is the first time, so no one knows. Maybe likely that I exist. But yeah, 12:30 to 1 o'clock, Monday to Friday, at least Monday to Thursday for sure. Um, but I'm there to answer questions. It doesn't have to be coronavirus. I can talk about a whole bunch of other stuff. And next time, I think I'll clean this board up and everything, and have it. This hasn't been erased for a long, long time, and I can answer questions using whiteboard or what have you, and we can talk about whatever anyone wants to talk about. It doesn't have to be coronavirus. It could be just other ailments, heartburn, headaches, nausea, vomiting, stuff like that, diarrhea, whatever. Um, but I figured since the office is there's not as many people coming because so many people are scared, but people are still coming here and there. Um, but yeah, if anybody any questions, again, 12:30 to 1 o'clock Pacific Standard Time. I'm in California, so if you're in the East Coast, obviously it's what 3:30 to 4 o'clock. Um, but if you have any questions, thank you again. All right, bye bye.